You don't know until you walk those shoes. And I walked those shoes before. So I know what it's like to go to bed hungry and not have. I know what it's like not to have transportation. I know what it's like to want what other people have and don't have it and can't get it. When I was young, my father was diagnosed with cancer. And at the time he was diagnosed with cancer, we had no idea that he was suffering from cancer. Out of 9 kids, he asked for me to come to the hospital to see him. So when I got to the hospital to see him and went there, they were trying to operate on him. Either they were trying to stop the blood or bleeding or whatever. But he asked me to go to school and come back and help the poor people. And then at the age of 17, I didn't understand what do you mean come back and help the poor people? How can I help the poor people and we are poor ourselves? So what can I give them that we don't have? Of course, we got a telephone call late that night telling us that my dad had died. And that was really the breaking point for me. And I just promised God, I said, if you just let me survive, if you just let me make it, and I would go to school, I would do whatever it is to be a productive person in the community and come back and help the poor people. I do whatever I can help the poor people. From there, I just been rolling, trying to make a difference in the community because I made a promise to God. And he blessed me. He blessed me to get off that plantation. On the morning he died, and we were trying to bury him and get ready for his funeral. I recall the plantation owner coming to the house to check on my mom or whatever, but he came in, I opened the door and let him in, and he asked my mother how was she doing, and she basically said, under the circumstances, it could be better. And then he told her that he would need the house. Now he asked her first about 2 of my brothers being able to work on the plantation that we lived on. And she said no. She said they must finish high school and go to school and finish high school. So then he walked towards the door and he turned around and he told my mom that they needed a house for another plantation worker and that we had to move. It was cold. It was very cold. It was in November 1977. And putting us out and telling my mother that she had to move on the day we were trying to funeralize my father, it was devastating. And now, I just want to just give back to other people and not let them go through what I saw my dad go through. My biggest concern with the work that I do and the people who I'm working with, which are the underserved population, when you walk in those homes and you're trying to get people health care, or you're trying to get them to become involved in the healthcare system by getting a physical examination. And it saddens me when I go there, here I am going to talk about healthcare, but on the other end, when you see a person don't have food, they don't have gas, they don't have light, that's heartbreaking. So now I got to step out of the shoes that I'm in, addressing healthcare disparity or cancer health disparity, and try to figure out how can I go back and tap into some of the resources here in my community and ask for donations. I asked for a local grocery store in Greenwood called Greenwood Marketplace, who are very good about giving donation. Could you please provide this family with food? On holidays, when you and I probably sitting there eating turkey and ham, I've gone to people's houses and saw one lady where she was killing blackbirds. Blackbirds. That was her Thanksgiving dinner. That was heartbreaking for me. And to lay there at night, and I lay there many nights, waking up at 3 and 4 o'clock in the morning, praying and asking God for additional resources. The resources here in the Mississippi Delta are so few to none, and the people who have the power to help make things better for people it's not in their heart. It's not in their heart. And just trying to provide people with the basics. And again, I go back to say to you, people don't, nobody want to be poor. I got with the people and I said, let's create a Fannie Lou Hamer Cancer Foundation. I had gone to Washington, D.C. and participated in a conference that was done by the National Cancer Institute. And I heard this man say, his name was Frank Jackson. He was the Cancer Health Disparity Director. And I heard him say that Fannie Lou Hamer was his hero and that she had died from breast cancer, stage 4 breast cancer. I got with two of her adopted daughter and said, look, what about creating a cancer foundation in the name of Miss Hamer? And the community was very excited about that. We had a meeting. People came to the meeting. We had invited 50 people to the meeting. We had about 75 people from all over. And we just saw the enthusiasm and the excitement and the energy that was from that meeting. Because that meeting was so exciting and the people were so excited about the Cancer Coalition, I said, okay, let's go a little further and do a cancer foundation. In less than 2 months, you got a 501c3 tax ID number. So that was my saying there to go ahead on and do what I had promised God by coming back, helping the poor people in the community. From there, we started the Fannie Lou Hamer Cancer Foundation in 2005 of March with a tax ID number. And from there to now, we're still out there helping people. I started this foundation because I've seen so many programs coming into the Mississippi Delta over the years. From my childhood until where I am right now, I see programs always coming in, want to do research, want to come in and gather information. And then by the time that people realize the programs in the community is gone because the money for that program have run out. And I'm so grateful to the University of Southern Mississippi, where I work. They've been here in this community for 20 plus years. And they have helped with this Fannie Lou Hamer Cancer Foundation to give people hope, to show them, to give them something that's tangible, and say this is owned and operated by the people. This belongs to you. People help with this foundation. The community health workers who are known as volunteers, they raise money all the time for the Fannie Lou Hamer Cancer Foundation. Whenever we are trying to implement a program, health fair, any kind of activities that's addressing cancer health disparities, it hurts. It hurts a whole lot. So when you're out there and you're hearing people asking for help on any given day, people calling me 3, 4, 5 times after 5 o'clock, asking questions. If I go to the grocery store or to Walmart, or if I'm in church, I can't leave church, when church is over because people got you in the parking lot and you spend another 30, 40 minutes, sometimes an hour in the parking lot trying to answer questions and trying to give people resources that they need in order to survive. So it's by no means that people don't want help. People do want help. Nobody asked to be poor. When we didn't expand the Affordable Care Act for the state of Mississippi, it hurted our patients, it hurted the community as a whole, and it hurted our medical providers. And it's a shame that people don't see the need to expand the Affordable Care Act, something that should have been expanded, something that needed to be expanded. And because of the lack of not having the Affordable Care Act, people just don't have the money to go to the doctor. Even with people who got insurance, your deductibles are so high. My deductible for my insurance is $1,000. And I have to spend $1,000, towards medical even before I can start seeing anything. And when people don't have any health insurance and trying to go to the doctor, and when you try to out there in the community telling a person to be screened for prostate screening or for getting a mammogram, or just go get your physical examination done. And for what? They say, I don't have any insurance, so if I got cancer, how would I pay for it? If I'm a diabetic, how can I get my medicine? Those are the type of questions that you're hearing people say. We do need Medicare, Medicaid, and we do need the expansion of the Affordable Care Act. That's something that's very needed. And I'm seeing our rural healthcare medical providers. Some doors are closed. We are losing some hospitals because there's not enough patients coming through those doors, keeping those doors open. And people can't come if you don't have insurance or you don't have Medicaid or Medicare. So those physicians got to be paid as well. They can't see everybody free. You have to be innovative and find resources. So one of the resources that I found here in the Delta was to create a license plate in the name of Miss Hamer. And this is the license plate. This license plate was created and done by the people, for the people here in the Mississippi Delta. More than 2,000 people have purchased this license plate. And it's a license plate that is approved by the state of Mississippi. And every license plate that is purchased by any individual, the state gives the Fannie Lou Hamer Cancer Foundation a $24 back to the organization. As from 2016 to where we are right now, we have received more than $100,000+. And that money goes back to the community and it helps people. And knowing that we are able to help people when they call us and say, I need medicine, I need transportation, we are able to give those people a stipend anywhere from $50 to $250 a stipend for transportation to get back and forth to the doctor. We bought 5 acres of land in Rubia, Mississippi for a resource that is much needed, and that's a cancer center. Our goal is to put on a 10,000 square foot building, cancer center, a resource center in Rubia, Mississippi. And I have a copy of this building. This is the foundation that we're trying to raise $2.5 million to put in Rubia, Mississippi. We have raised more than $800,000 towards this project. And we've been working on this project since 2005 and it's 2020. It's a long process. It's very tedious. There's some nights you cry. There's some days you're happy because people like you that come into the Mississippi Delta and you seem to need. PCORA have come to the Mississippi Delta and have seen the need, and they have supported the work that we do at the University of Southern Mississippi and with the Fannie Lou Hamer Cancer Foundation. And because of that national recognition from your organization, from Patient Advocacy Foundation, and from PCORA, it has helped open up doors.